Welcome everyone to the CBAS ICD 10 Conversion Forum, and thanks for joining us today. We appreciate you taking the time out for this really important conversation. I'm Denise Peach. I'm the chief of the CBAS branch here at CDA, and we have a whole bunch of folks here that are going to be speaking today and participating in this panel discussion. And so as we get started here, I just want to run through who's going to be on the panel today. As well as all of you who are going to be working together as we try to find answers and address some of the issues that you've raised as CBAS providers. So the Department of Aging is here. I'm here with Lilith Tomasian and several of the staff who are helping with run this webinar. We have our colleagues at DHCS on the line. We have Cal OHI, the California Office of Health Information and Integrity, and folks who are heading up the ICD-10 conversion project for the state. We have Lydia from the California Association of Adult Day Services. We have the three main software vendors for CBAS. That would be CoreLink with their iLife product, and the RTZ Associates and their CAD-Care product, and TurboTar with their Turbo ADHC product. So they'll be here to speak a little bit at the first part of this webinar, and then we'll go to all of your questions and general discussion from there. We also have a lot of Medi-Cal managed care plans on the line today. We thank you for joining us. We've got your names flagged, so we're watching for you if you want to pop your hands up or send in information as we go. We'd love to hear from you today too. And then of course a lot of CBAS providers. We have over 200 people who are in attendance in this webinar today. So thanks for joining us, and we're going to get started. We have just an hour. If we need to go over, we can. But we're going to try to get the conversation going in the 1 hour time frame and address your questions, at least the main themes, and those that we don't get to, we'll work into an FAQ document for posting on the website later. So let's go to the agenda. At the top here, we're just going to do a little bit of introductions and setting the stage here with what's happening with the conversion and overview, and then we're going to come down into some status reports we did for our CBAS provider community. We did a survey recently and found out from you how you consider your readiness and some of the issues that you're having, some of the concerns you have. So we want to share those results with you to sort of set up the conversation for today. If there are issues that some providers raised and others didn't, maybe it'll help folks think about what kinds of things they need to be thinking about as we go forward into this October 1 implementation date. Then from there, we'll go into some status reports from our software vendors and find out what's happening on their end, what they're hearing, what they're doing to make their products ready for the CBAS provider community. And then if there are any Medi-Cal managed care plans who would like to raise their hands and jump into the discussion and talk to us about what they're doing. We don't have anybody really queued up specifically to be speaking today from the plans, but if any of you out there would like to share some of the things that are going on at the plan level, we'd be happy to hear from you. And then the last half of the hour, we want to have a really robust conversation with all of you, your questions, and try to find out either the answers or direct you to resources to find them. And then we'll wrap up at the top of the hour or a little bit thereafter if we want to keep going just a few minutes over. So that's what we have in store on the agenda. A few housekeeping items now. And Lilith, you want to share those with us?
Yeah, let me do that. So we emailed a copy of the slides to everybody who had registered, and we will also post these on the CDA website after the webinar. We will also be posting the recording later this week. And I just wanted to share with you there's a new feature that the GoToWebinar has now. So if you look on your control panel, under where it says polls, you'll see a section that says handouts, and we've attached the slides to this section. So if you click on that blue link, it'll actually open the slides if you haven't received them already. So just wanted to make sure that if you want a copy of the slides right now, you can access them now through the GoTo panel, which is a really cool feature that they now have. And then lastly, I just wanted to say that we're going to be focusing a lot of the attention in the webinar to a Q&A, and we reserve a lot of time at the end of the webinar to do that. And I think that's it for housekeeping, so I'll turn it back to you, Denise.
Okay, great. So our webinar objective very simply that we want to have a forum for discussion today amongst all these parties, the CBAS providers, the state, managed care plans, and our CBAS software vendors to address concerns related to the upcoming ICD-10 conversion. So this is an opportunity for all of us to have a conversation today. Like I said, I don't think we'll have all of the answers, but in raising the questions and the issues today, that we'll make a big step forward right there. So that's our objective for today, and let's get right into a little bit of an overview. So I just wanted to remind everyone, the CBAS providers anyways, that when we started back in April communicating again with you, because this conversion has been scheduled a couple times and called off. We were going to do it in 2014, but 2015 is for real. And so we started back in April communicating with the CBAS providers about the transition and what was to come. This is just a little snippet from some of the things that we shared in our first all-center letter back in April. Subsequently, we've shared a number of trainings that have been scheduled, and we hope that many of you have been taking us up on those training offers, and there'll be a few more coming, and we'll talk about that at the end of the hour. Basically what we tried to get out there loud and clear early on was that the transition is happening. It's to accommodate this transition from the 9 codes to the 10 because the 9s are limited and outdated and obsolete in many ways, and the new era for healthcare and HIPAA require the ICD-10s. So who's affected? It's all HIPAA covered entities, so that was your heads up. CBAS providers, yes, everyone is affected. Everybody who uses diagnostic codes for authorization and billing purposes, and then we just let you know that it was coming on October 1. So that's the very, very high level. From there, what I would like to do is to invite our colleagues at Cal Ojai, Wanda Yepes and Bob Summers, to give us a little bit of perspective from where they sit on the statewide implementation of the ICD-10 conversion. So if we got you on the line, Wanda and Bob, this is your chance to tell everybody from your perspective what's going on.
Hi everyone, thanks for having us. I'm Wanda Yepes, this is Bob Summers. Just a little bit about Cal Ojai. We're the California Office of Health Information Integrity, and our role with ICD-10 is really to support and monitor all ICD-10 affected state departments, and then report the status to CHH agency in preparation for the October 1st transition. We're not professional coders, but our job is to, through the state departments, give tools and support to the providers through the state departments we're monitoring. Let me just kind of give you a little bit of information about ICD-10 in general. ICD-10 stands for the International Classification of Diseases 10th Revision. It is used worldwide, and one of the things that is different about ICD-10 versus ICD-9, as you can see from the slide, that there are a vast number more codes in 10 than in 9, and that's due primarily to the increased specificity and the addition of laterality, left-right definition.
Hey, Wanda, I'm sorry to interrupt. This is Lilith. We had a comment asking for you to speak a little slowly.
Oh, of course.
If that's okay.
Thank you. What I was saying was that ICD-10 is a vast improvement over 9 in that there's increased specificity, there's laterality, meaning left-right definitions, and because of that, there are considerably more codes in 10 than in 9. It's not a one-to-one match. As you can see from the slide, one code in 9 translates to 10 codes in 10. The benefits of that are that from a public health perspective, it's much easier to keep track of trends for research, and each code carries a lot more clinical information than it did in 9. Ultimately, as we go through this transition, it's a difficult transition because we have to learn the new codes, but on the far side of it, it will be a far richer tool that we're going to be ending up with. And probably the thing that I most want providers as they're going through this transition to remember is that even though there are a vast number of more codes in 10 than there were in 9, you really only need to worry about those that affect your practice. You know, there's codes for every possible specialty, and you don't need to know them all. You just need to know the ones that relate to your own practice. Later on in the presentation, when we get to the resources section, there'll be a number of links that you can use to get ICD-10 codes for your specific practice. And there's all the Centers for Medicare and Medicaid Services, their website has wonderful, wonderful resources, all kinds of tools and categories of codes, and I think they will be very, very good use to you as you're preparing for having the kind of the stable of codes that relate most to your practice.
All right, Wanda, thank you for some opening comments there. So is that everything that you wanted to start off with anyways, and we'll move on to sharing some of our survey results?
Absolutely.
Okay, great. And you're going to be on the line, you and Bob, for answering questions as we go. So
Absolutely.
Sure. Okay, so then I think we're going to move to a sharing of our survey results. So Lily, you want to take that?
Okay, thanks, Denise. So about a month ago, we distributed a survey to all of our CBAS providers to get an idea on how prepared they are for the upcoming conversion process. And we've received responses from approximately 75% of providers statewide. And the questions that were centered around the themes of awareness and readiness in general, preparation and training processes that the providers were engaged in, and also concerns that they wanted to be addressed, and also requests for training opportunities and resources necessary to complete the conversion successfully. So if we can go to the next slide, we can actually talk about the survey results. So I wanted to discuss the survey questions in these next few slides, but I'm going to focus on some particular areas just because we have so much to cover today. So based on the responses that we received, it appears that most of our providers are at least aware that there's an upcoming change, which is good. However, as far as being prepared, it seems that majority have indicated that they're only slightly prepared for this change. So if we look at the next slide, the chart shows exactly what the providers told us. So about 40% feel they're somewhat prepared, but about 30% feel they're not very well prepared at all. And so we hope with today's forum and hopefully with the information we've provided thus far, these providers will feel that they're a little bit better prepared for this transition. Next slide. We also asked providers if they participated in any trainings related to the transition, and an overwhelming majority stated that they have not been participating in any trainings. So we hope that there will be something provided in the near future for them to attend, and we have some resources at the end that we'll be sharing with everyone. But for those who said they attended trainings, it seems as though a couple of our managed care plans provided those, so CalOptima and Sutter Health were two of those plans. Providers also attended trainings by CMS, and some of our software vendor provided trainings, and then some also attended trainings provided by the Department of Public Health. Some providers indicated they actually attended more specific training related to coding, and then some indicated they did their own internet research. Next slide. As far as steps taken to prepare for the ICD-10 implementation, so as you can see on this chart here, about 45% indicated that they mapped existing participant diagnoses to the new codes. We're not sure if this was a manual process or if this was done through their software automatically. And then 60% though said that they actually worked with their software vendors to map the existing codes, which is great that they're working so closely with the software vendors to make this process as automated as possible. About 43% indicated that they've communicated with the managed care plans and understand their requirements. We would really like for this number to be closer to 100%, as we want to make sure you're communicating with your managed care plans. So if you haven't done so, we hope that you will after the conclusion of this webinar. And then finally, we asked if they've contacted personal health care physicians to clarify these new codes, because as Wanda mentioned, there are so many more of them now and they're so specific. that you may actually need to contact your PHCP to get these clarifications. And it seems about 18% of our providers have done that. Our providers also spoke about some additional steps that they've taken, so I just wanted to kind of highlight a couple of these, particularly the ones that are in red. So the first one, some providers said that they haven't done anything at this point. Of course, we're a little concerned about that. And hopefully by today you have taken some steps to get ready for this transition. And then some of you also indicated that you're manually changing the codes. Again, this is a little bit concerning as well, just because it's such a daunting process. So for those of you, if you don't have any software support, this may be a good time to consider purchasing some kind of a software package. I think that's all on this slide, so let's go to the next one. Okay, so here providers also indicated the types of resources they hope to obtain for the transition. So in general, they're requesting some software support, general resources, like we've indicated on the CMS website or other websites, general training on the actual transition, and then some more specific training on coding itself. And then some other additional resources that they're requesting that we've highlighted here. So for example, they're asking for some kind of written instructions and training from DHCS and managed care plans, or some kind of a call center that providers can reach out to if they have any questions, etc. Okay, next. We also wanted to get an idea of what direction providers have received from managed care plans. And I've included some of the main themes on these slides, so I wanted to highlight again just a couple of these, as these kept coming up through most of the provider responses. So one of them was that there was no written guidance from most plans, and also providers are unclear how different plans will handle the crossover authorizations and claims, as they appear to receive different guidance from each of the plans. So hopefully during the Q&A section of the Q&A, we can address some of these concerns that you have. Okay, and then finally, we wanted to for providers to indicate what specific questions or concerns they would like to have addressed at this training. So some of them were related to software conversion specifically. So some providers are concerned that our software vendors will not be ready on time, or they're concerned that they'll need to manually map the codes as opposed to the software automating the conversion. There were some specific concerns related to the ICD-10 code conversion. So they're concerned about additional staff time required related to implementation, which is a pretty valid concern. Many of the physicians they've contacted have not yet implemented ICD-10 codes. And then the next logical question is it allowable for the CBAS centers to convert ICD-9 codes to ICD-10 if they are unable to get these codes from the physicians? And then finally, where can they obtain the CMS ICD-10 codebook? And also, as far as the managed care plan processes, really the question is there going to be some kind of a grace period that the managed care plans will be giving to the providers? So as you can see, providers have raised many valid questions and concerns, and hopefully we can address these during our Q&A portion, and also through the updates that we're going to receive from our software vendors today. So that's all I wanted to share on the survey results. So I'll turn it back to you, Denise.
Okay, great. Thank you. And yes, we will come back to these questions. We want to let the software vendors share with us first, and then and maybe they'll answer some of them as they go through. So let's. This is the set of questions that we put to our three software vendors that are on the line today. So we hope they're going to be able to address, in this context, what's going on at CoreLink, at Artesia Associates, and at TurboTax. So first up, let's go to Steve from CoreLink. Steve Breaker, are you on the line and ready to share with us?
Yes, I am. Thank you. My name is Steve Breaker with CoreLink Systems as iLife ADHC software. So first, our readiness status, our ICD-10 implementation is ready. We've conducted testing with several plans, some directly and some indirectly through clearinghouses with positive results. So we're expecting a smooth transition. So I'll explain here what, as an iLife client, you would expect to see in the software system. All of the updates to the software are automatic and have already occurred. So what I'm describing here today is available to you now. And you can also read about it and see screen examples by viewing the news and recent updates link on your iLife start page. So how and where do you input the ICD-10 codes? Well, on the same screen that you have been using to input the participants' ICD-9 codes, you'll notice that there are also fields to input the ICD-10 codes, and they're listed side by side. 9s are on the left and 10s are on the right. And of course, our objective is to have a 10 code completed for the participant for each 9 code you already have. So whenever possible, you want to get the new ICD-10 code from the physician. So just input those codes into these fields, as participants' ICD-10 fields. And iLife does have a library of all ICD codes, so when you input one, iLife will validate it and make sure that it is in fact real and accurate. Sometimes physicians only provide a description but no code. So in these cases, you can use, iLife has an integrated ICD-10 search pop-up from that screen, and you can find a code that matches a description. So if you don't have a code from a physician yet, and you still want to complete the ICD-10 fields, which is probably true, you can use iLife's integrated ICD-9 to 10 mapping pop-up screen, and this is accessed using a button next to the participant's ID ICD-10 fields I've been describing. If you click on it, iLife will display a pop-up screen showing the ICD-10 code that matches the participant's corresponding ICD-9 field. And this mapping data was created by the work of other CBAS centers as a collective group that are using iLife software. So as you're doing your work for each participant, you need to check progress to see which participants are done and which are still missing ICD-10 codes. And there's a report for this that shows all of your participants in one list, along with their 9 codes and their 10 codes in a table. And you can see the missing ICD-10 codes are highlighted on the screen. So this report makes it easy to see any gaps for a particular participant. And you can run this anytime, so you'd want to run it periodically and see where you're at in your conversion process. Now really that's it. The rest is automatic, so iLife will use and display the participant's correct code set, ICD-9 or 10, based on the transition date. So for example, billing claims with service dates prior to October 1st will have 9 codes, and those after will have 10 codes. And the same is true for IPCs you create in iLife, or IPC cover sheets, and also for your electronic flow sheets and any other documents that come out of iLife. So, okay, that's it. I'll be here to answer any questions you have during that part of the session.
Great. Thank you, Steve.
Thank you. Yes.
Comprehensive and brief. We appreciate it. Okay, yeah, hang around for some questions. So next up is Laura Emery from RTZ Associates. I hope we got her. We had technical difficulties earlier. Okay, so we're having trouble with Laura. So if we get her online here, we'll bring her in a minute to talk about cat care. Otherwise, if Laura, if you're out there and you can hear us, you can certainly type some things in and we'll read them for you. And in the meanwhile, we'll go to Renee Nashton from TurboTar. Renee? Okay, Renee.
Hello, everybody. Can you hear me?
Hey, now we can hear you. Yeah, thank you.
Hello, hello. Hello, world. All right. Everyone can hear me well?
Yeah, we got you. Thank you.
Okay, fantastic. So hi, everyone. My name is Renee from TurboTar. Many of you already know me because I have the pleasure of working with you. And for those of you that don't, TurboTar sent you guys a helpful ICD-10 cheat sheet in the mail. Hopefully, many of your centers have already received it. It's a laminated card with common ADHD ICD-9-10 conversions that you can use if you're not already using our software. And we hope that at least for those of you that aren't using our software, it will help you with your most common code conversions so you don't have too many growing pains with this transition. Part of TurboTAR's mission is working with CBAS centers in order to optimize their processes and automate tasks that are normally done manually in order to maximize the amount of time that you guys can give to your participants. So first off, before I go through all the questions on the screen, we want to thank our current clients for their support, and thank you to all of those who have called us recently and come aboard for the ICD-10 transition solution. So with the ICD-10 transition, TurboTAR has continued to follow its mission and answered the demands of the transition in the same way. So CDA kindly asked us to provide an outline with the work that we've done in regards to this transition and how we're supporting you. So most of you know that obviously you must have a conversion for all your ICD-9 codes to their ICD-10 equivalent. If you are a TurboTAR customer, our ICD-10 mapping program will take care of this for you. TurboTAR actually utilized the mapping suggestions in the GEMS ICD-910 crossover documents, and all available mapping was done for our clients and included in their upgrades in August. What that means is that all of our clients, first of all, are already upgraded. It was done in August, and about 75 to 95% of all of their codes were automatically mapped based on this crosswalk. The codes that were automatically mapped were mapped because they did have a one-to-one conversion equivalent in the GEMS mapping tool. So that greatly minimized a lot of that manual labor. As you know, as folks from Cal Ojai pointed out, we did go from almost 1,500 to 70,000, or 15,000, excuse me, to 70,000 codes. And so that's quite an expansion, and a lot of codes will not convert one-to-one. So what Turbo ADHD software is doing for those codes for you guys is part of its mapping tool that clients already have and have used is those codes that did not map one-to-one actually have suggested codes. It's already in the functionality. So that way users can go ahead and select the correct code based on their judgment or what their primary physicians are giving them. And again, all clients already have this particular functionality. The third thing that TurboTAR realizes, and that I think is also apparent that Lilith touched on that's really important, is that we are, as ADHD and CBAS centers, secondary providers, which means that for the purposes of ICD-10, we're not the first medical providers to evaluate participants, meaning that we get a health record that contains ICD codes and or descriptions. And we rely on these medical records from the physician in order to receive accurate diagnoses and ICD-9 codes. So for our clients, if your codes did not convert one-to-one, all of those suggestions that came automatically out of your Turbo ADHD program actually have a button where it will just generate a letter to the participant's physicians and go ahead and fax the physician all of the code conversions and the options of all of those codes. So that way you can go ahead and check with physicians to make sure that they are okay with the mapping that you have done. And it's also included in their charts. The nice thing is this feature included in our software actually also has a fax generator. It's a one-click button, and it will go ahead and send an e-fax if you have an e-fax account with multiple providers to all of your participants' physicians so they can go ahead and review those. Most Turbo ADHD clients, when they receive their upgrade in mid-August, have already actually done this and letters have been sent out. So they're just verifying. The next question is, after October 1st, and for some managed care organizations earlier, we've gotten notes from clients that you guys have been receiving requests for authorizations that include ICD-9 and 10 codes. We know we've got a lot of calls from you guys that you've gotten these requests, and they continue to change from week to week. And we just want you to know that, as included in your August upgrade, Turbo ADHD has that ability to generate all those request forms with the codes of your choice, so you don't have to manually redo anything or, write or type or whatever that may be. we wanted to make sure that this is, done by August, so you guys wouldn't be rushed to resubmit authorization requests, that would expire on October 1. So the next point is that all claims must be submitted using ICD-10 codes for dates of service on and after October 1st. That's done automatically in your Turbo ADHD software. It's smart enough to know which codes to choose based on the date of service. And again, that functionality was included in the upgrade done in August. TurboTAR, and one thing that's very, very important to remind all providers, regardless of software usage, it's important to maintain both sets of codes, because as an ADHD CBAS center, oftentimes we bill retroactively. And we have to remember that, again, for dates of service prior to October 4th, you need to make sure that you do have your ICD-9 codes in order to, submit that billing. So again, your Turbo ADHD software maintains both of them. They map both of them for you, and changes are made automatically. Also, just as Steve noted, changes need to be made in patient medical records, your IPC, and your authorizations and TARs. And again, this is all automatic in the Turbo ADHD system. And for those of you, again, that are not using it, remember that you have to edit your current TAR authorizations and billing to reflect ICD-10 codes for October and beyond. Again, we are doing this automatically, but we want to make sure that if you don't have the software support, please look at your authorized TARs after October 1 and make sure that they're pulling the right code or you're billing with the right code. And that's about it as far as our software. Essentially, everything that anybody needs to know is that our upgrade was done. Our clients had the upgrade in August, and everything was mostly mapped for them. So the changes were available before, and it's free of charge, of course, with our software. It was automated. There's no steps that providers have to take. Providers and users of Turbo ADHD know that they always have a support page that they can go to log in with their credentials, and that support page includes videos and PDF guidelines of how they can use the new features that they have, and as well as newsletters about what's going on. As far as testing is concerned with other entities, including managed care organizations, currently we are testing with health plans that have reached out to us, and we have reached out to health plans. So far, all test files that we have submitted have passed all preliminary steps, and we're kind of just waiting on anybody else. So contact information, yeah.
Yeah, I think we got to move on, and contact information is on the last slide, so we got that covered. And
sure.
You're going to hang on the line to answer any questions if we get them, right?
All right, sounds good.
Okay, great, thanks. Because I think we've got Laura on the line, and we got a ton of questions to get to. Thank you, Renee, very comprehensive.
Sure.
Okay,
Yeah.
Laura, are you there?
Yeah, this is Laura. Can everyone hear me?
Yes, we got you now, finally, thanks.
Hot dog, yeah, I know. Cell phones are exciting. So thanks again to everyone. I'm glad there was really good participation on this. We've shared a lot of updates with our clients, but happy to be able to share it in a forum where there's a Q&A and a group participation. So thanks again for inviting us, and thanks to our clients and everyone else for listening and participating with questions. I'll just try to run through things briefly. I know we have a lot of people who have a lot of questions. For the conversion process within CADCare and just the status of the updates, the conversion process, as you heard from the previous presenters, that we went from just over 14,000 codes to just under 70,000 codes. So there's a huge jump in terms of the number of codes. Many codes do not have a one-to-one match, and this is information that is supposed to be provided by the primary physician in an ideal world. It's not always. So within our system, there are some automated tools based on CMS's general equivalence matching tools, which any crosswalk that you have is going to be based on that same general equivalence matching tool that was released by CMS to help crosswalk those. So there are tools within the system to help identify the correct codes, especially in cases where there's not a direct one-to-one match within the system. Additionally, there are questions on authorizations and billing. For the IPCs, there is a function that will split those by date, so it'll have the information for the ICD-9 and ICD-10 codes that's date-specific, we did really as much as we could to minimize the changes for the end user. So a lot of what you're going to see is on the back end, where if you go into an IPC that starts after the deadline and you try to enter in an ICD-9 code, you're going to get an alert. There are reports so you can run completion checks within the system to make sure that the data is updated. And then there's also billing safeguard checks on the back end. In terms of the update status, we have the update live and in production. We did testing with our providers before it was released. If you do not have the update, you're welcome to call us or email us to schedule an appointment, and we'll get that taken care of. I am listed as the primary contact, but you can also use just our regular CAD Care tech support email to schedule those. And the update is a very quick process to get that through. In terms of guidance and things like that, obviously we always have unlimited technical support for our CAD Care clients. You have the ability to walk through information over the phone, so we can do a training with folks as we're running the update. There also are written materials and quick guides that accompany that update, and we can also schedule separate training for staff if that's helpful. I know the contact information is going to be addressed on slide 2 or 22, so we'll get to that, but I'm happy to answer any questions as they come up from folks.
Great, thank you, Laura. Appreciate the updates, and we are going to have you answer some questions, I'm sure, as we go forward. So we'll keep the line open. So can we go on to the questions now? Lily, you want to give us some, and anybody who's on the line who wants to raise your hand, if we can make it happen, we will open up the line and let you ask your question verbally. But in the meanwhile, type things in and we will read them. We have a bunch of questions already queued up.
Okay, so first question. Can we start using ICD-10 to apply for services that begin prior to October 1st? If we can, do we use ICD-10 to file for claims for these services prior to October 1st?
Okay, so I'll take a first stab at it, and Wanda and Bob, you can help me out, possibly here, or anybody actually who wants to help out. So, so as far as services authorized October 1 and beyond, those come in with the 10 codes. So if you're submitting TARs in or authorization requests to the managed care plans in September for dates of service 10-1 and beyond, they need to have the 10 codes in them. And then, of course, any services billed, whether they were authorized as 9s back in August or anytime authorized as 9s after 10-1, you're going to be working with your managed care provider to make sure that you're doing the billing exactly as they ask you to, either splitting billing or having single billing for the 10 and 9 periods that are covered on for one set of service authorization. So, so with regards to submitting it in September, again, for services that are 10-1 and beyond, yes, they need the 10 codes. For services prior to that, they should still be 9 codes. But again, working with your managed care plans to make sure that you submit your authorization requests as they ask you to, and you deal with current authorization requests that are in the system as they have asked you to, because there are different plans having different policies on that. Is there anything else, Wanda or Bob, you could add to clarify?
Actually, you did a beautiful job explaining that.
Okay.
Okay, how about if we code the ICD-10 wrong on the IPC, will the managed care plans or DHCS provide us with a correct code?
So that's a question that I can't answer, Denise, at CDA, and I think Wanda, I don't know what the standard answer coming out of Cal Ojai might be on this, but I think that I would just default to, you have to work with your managed care plans to find out what happens, what their contingencies are in the case of coding errors. If something comes in the same family of codes, whether they will treat that differently from a blatant error, I can't speak to that, but it's something that you want to coordinate with them on. And Wanda, did I hear you wanting to weigh in?
Only that I know that DHCS cannot provide providers with codes. All the codes must be generated by providers. DHCS cannot provide codes to them. And I would just urge providers to get, the most accurate code you absolutely can to prevent delay in being paid, because DHCS cannot say, okay, this is the code you should be using. They have to be generated from the providers.
So it was a little bit unclear on your end, so I'm not entirely sure we all got that. Is there any way you can speak a little bit differently into the phone there, Wanda?
Sounds a little muffled.
Yeah, it sounds a little muffled.
Is this better?
Much better.
Okay, I'm actually leaning over the speaker now. So what I basically said was that DHCS cannot provide, quote, the right code to providers. They cannot give that information to providers. The codes that they process must be generated by the providers to them, and so it behooves the providers to come up with the most accurate code you can when submitting it to prevent any kind of delays in payment. Like I said, as your software provider said, and some of the tools we'll be providing later, there's a lot of tools to prepare you to get the right codes ready, but DHCS cannot go and say, oh, you got the wrong code, use this one instead.
Okay. And yeah, we have a number of resources cited at the end, and as Renee indicated, that they have sent out cheat sheets of the most common code conversions, and so there are some tools out there for making sure that we get the right ones in the first time. So next question.
Okay. How will DHCS address delays in encounter submissions as delays in submissions occur due to rejections for using ICD-9 codes? So I'm not sure if we can.
Yeah, I'm not sure we can address that one either, because it's going to be plan specific. The vast majority of participants served in CBAS now are managed care. There's only about 450 or so fee-for-service participants. So that's going to be a managed care plan specific issue. And if there's anybody on the line from DHCS who wants to jump in, feel free to raise your hand, and we'll open up your line. Wanda, anything on that?
No, no, I really can't speak for DHCS, but I know that they are doing everything they can to process claims as quickly as possible and to deal with any claims that are having difficulty with the adjudication as quickly as possible.
And they're also staffing up.
But again, I just remind everybody that that's a very small number of participants whose TARs are actually being processed and claims being processed through DHCS for fee-for-service. So it's primarily an issue between the CBAS provider and the managed care plan. Next question.
Okay, there was a technical question that we had. So I have found an incorrect conversion from ICD-9 to 10. I brought this to the attention of the programming company. They pointed to a governmental conversion that was incorrect. What can we do?
So software vendors on the line, does anybody want to talk about anything that might be incorrect in your systems, or, you know, if one of your clients identifies them?
Yeah, I can speak to that. This is Renee from TurboTAR. Can everybody hear me?
Yes, we got you.
All right. So as Laura also stated, the conversion mapping tool that we're using is the GEMS conversion mapping. It's a standardized tool that everybody, you know, is using for any conversion mapping. If you are unhappy with the GEMS mapping, you can always go ahead and delete the ICD-10 code and enter whichever ICD-10 code you would prefer or that your physician prefers. So again, remember that the GEMS conversion tool is a mapping guideline, and obviously, ultimately, it is the physician that assigns the ICD codes.
Great. Anybody else?
Steve here, pretty much the same for iLife. Just let us know the code if you think you see a map that's incorrect, and we'll take steps to correct it.
Okay, we have another question. There was an indication for Medicare that there would be some latitude for code errors during the transition period. Does this apply for Medi-Cal in any way?
So I'll take it first, and then Wanda, I need your help here. So essentially, I think yes, there is information out from CMS that addresses some back-end sort of leniency on their audits with regards to coding errors. That has to do with CMS on the back end and their auditing processes. So that doesn't address anything that happens at the authorization level or at the claim submission level. Again, you're working to get the codes into the same family and as accurate as possible based on your correspondence with the physicians to clarify things. Your work with coders, your work with your clinical notes to arrive at those codes that don't have the one-to-one map. So yes, there is some information out there about Medicare and CMS on the back end with audits. I think that the issue has to do, again, just with the back end with audits. It doesn't deal with the issues that will arise initially with regards to authorizations and claim submission. So we'd encourage you again to work with your plans with regards to what their policies are with regards to that. Anything else, Wanda, that you'd have to add to that?
No, Denise, you covered that really well. Basically, it is a very, very specific thing. It is about Medicare, and it is about basically not dinging people in an audit, in the back end. And basically it's about specificity. If they get in the right family of codes, but the specificity may not be perfect in the auditing of that, they're not going to ding physicians for being inaccurate. It has nothing to do with getting the codes paid or processed on the front end. It's only, as you said, a back-end auditing leniency. But again, it's only about specificity, and it's only about Medicare.
Good.
Okay, so we had a few questions come up related to the physician diagnoses. So I'll read one of them. What do we do if the PCPs are not providing us with the correct ICD-10 codes? How else are we supposed to get the correct ones? Also, I would like to know how other providers have obtained ICD-10 codes from the PCPs. Is there any recommendations in the room?
Okay, so in the meanwhile, if there's anybody who has providers who have suggestions about working with the physicians, type your response in now. That'd be helpful, and we'll share that. The first thing that comes to my mind is that you have staff physicians that you can work with to help clarify. Part of the challenge, I think, not nearly as big with the ICD-9s, but I know that this has been an issue with the CBAS centers. As the secondary provider, you're relying on the physician to give you your history and physicals with the diagnoses, and often those come without the 9 codes, and the 9s being so much simpler through the clinical notes and the understanding of the less complex ICD-9 codes. The clinical staff have been able to work with the physician's notes enough to get in the correct codes. That gets a little bit, quite a bit more complex with the 10s. But again, if the clinical notes, this is my understanding, the clinical notes are detailed enough, and you can ascertain from there what the correct code is, then you would be able to do that. And I think the example that Cal Ojai shared with that picture, kind of a busy slide, but with the hand on it from earlier, where you had 8 or 10 different diagnostic codes to go along with that hand laceration, that much of the specificity came around the, as Wanda keeps saying, the laterality, that which side, and so it's details that could be fairly easily discerned from what's in the clinical notes. So arriving at the correct code would be doable for the clinical staff based on what comes in from the physician. So again, I would just encourage you to, in the cases that get more complicated than that, you are going to have to go back to the physicians to get the clarification, work with your staff physicians, work with your clinical staff, look through the notes to see what you can get. But definitely getting it into the right family of codes is the first task. Anything to add on that, Wanda, or any of the software vendors, please?
Now, you explained that really well. Because ICD-9 and 10 don't map perfectly to each other, mapping is a really good place to start, but the clinical notes, as you said, really is the guideline for which code to pick, because the more specific the clinical notes, the easier it is to find the appropriate ICD-10 code.
Okay, great. Anybody, software vendors, anything else to add to that, or did we get anything typed in here from any of the other providers for suggestions? Meanwhile,
yeah, Renee from TurboTar.
Renee, yeah.
So again, just to echo the sentiments, it's really, you're looking at most of the time with the direct mapping that we did, we found that the codes that didn't map one-to-one were already in the same family. It's just the degree of specificity. So again, I'm echoing Denise, and look at your notes and see that, exactly what it is that your notes say, because it's just, again, one degree of specificity that we're looking at here. And then also a reminder that use the letter generator that's in the software. I know a lot of you have already used it to reach out to your physicians. You have multiple physicians, just like Denise said, you have your center physician that you can also consult with if you do not get an answer from the participant's own primary care.
And this is Laura Emery with RTC Associates, and I just would like to say, you know, one of the things that's important, and the reason that this is such a concern, obviously, is not just because there's a big switch or because we're adding a lot of codes, is because, you know, obviously in the middle of sort of a lot of different transitions that have happened over the past few years, this is another big one, and the ICD-10 codes tie directly into billing, so they need the same level of scrutiny that's being applied to the ICD-9 codes to make sure it's just a much bigger pool to look in. So I'd say again that you want to be sure that you're making those, you know, sort of eyeballing those to make sure that they are the correct codes and that they are matching up and looking at the information, and certainly the notes will help. If you don't have the definitive information from the physician, that's obviously the best place to get the information and where it should be coming from in terms of assigning those diagnosis codes. But making sure that the information is correct will obviously make things a lot smoother with the transition.
Yeah, and we did have a comment from one of our providers saying if the code doesn't match the one the physician assigns, won't that create a payment issue? And it sounds like it may. Okay, let me see what other questions we have here.
Anybody wanting us to open up the lines at any point here? Nope. Okay.
So another billing question. How would you know if the ICD code diagnosis is billable?
This is Laura with RTC Associates, and the tool that we're using within our system update actually will include that information. So it'll show you what the possible matches are for a code that doesn't have a one-to-one match, and it'll also include notations on whether or not the code is billable.
Okay.
This is Renee from TurboTar. Like always, all of our code tables that are included in the software are only billable codes.
So for our manual users out there, because this is Denise at CDA, I wouldn't even know how to address that question. For our folks who are out there doing this all manually, Laura, Steve, Renee, do you have any suggestions for how they might go about ensuring that they don't get a non-billable code in there?
Yeah, absolutely. There's a couple things that you need to remember. This is Renee from TurboTar. And on the form that I sent out on the back, if you guys have or have not received it, you can also go ahead and Google anatomy of an ICD code. And you'll be able to see and understand a little bit about how ICD codes are put together. And if you at least follow structurally, you will be able to identify very quickly, first of all, if your code is going to pass as a billing code. Points, zeros, all of those things are things that you want to look out for. So go ahead and Google ICD, anatomy of an ICD-10 code, or go ahead and refer to the document, the laminated document that I sent you, and look on the back. And it will go ahead and give you some pointers on, if you're not using software, how you could at least visually identify that the structure of the code that you're using is correct.
Great, that's helpful. Renee, Denise, what can we do to get a copy of that laminated card from you here at CDA?
You can send a carrier pigeon.
Good one. Okay, well, we'd love a copy of it if we can get one. So.
Absolutely.
Okay.
Anybody that wants to can email support@turbotar.com, and I'll be glad to pass one along.
Great, thank you very much.
Okay,
Sure.
And we also had a related comment from Lydia from CADS. Do you imagine that there could be a DHCS plan audit exception if the CBAS code based on the CBAS medical record does not match with the physician code whenever that's obtained? There may need to be a later reconciliation with the physician codes if they're more specific. Do you all foresee any problems with changing the code at a later date?
Yeah, so it's a great question, Lydia. Thank you. And I think what we're going to have to do on that one is I don't know the answer. I know Deborah Dixon was trying to get to this call. She's heading up the project for DHCS for the code conversion. Deborah, if you're out there on the line, definitely weigh in with us. Otherwise, we'll take that question and put together an FAQ with it. So we'll run down an answer for you after this. But I certainly don't have the answer. Wanda, I don't think that's in your area either.
Well, I would rather have DHCS after this.
Again, another specific question related to the codes. Should we put codes only for primary diagnoses or for all diagnoses?
So to go to the question of what happens after 10.1, and for CBAS providers to submit TAR requests and authorization requests and the IPC services after 10.1, everything that you send in with the codes is going to be the ICD-10 codes. Anything that the plans are asking you to do specifically around TARs in system now, so TARs that were authorized May 1 and beyond that cross over 10-1, you're going to have to work with the managed care plans, your managed care plan contractors, to find out what they may or may not want you to resubmit. So we've had some policy, sort of new policy coming out from various healthcare providers most recently about what they want you to do with those TARs in system, and I think that some of the direction thus far has been that they wanted a resubmission of TARs that crossed over 10-1 with 9 codes for the dates preceding 10-1 and the 10 codes after 10-1. Some of the plans have retracted that now and are saying that you don't need to redo your TARs in system. But as far as 10-1 going forward, services authorized 10-1 forward, you need to have your all of your codes that go in on both the authorization requests, so primaries and secondaries, all the codes that are on the IPC will be coded as ICD-10s.
And then I'll read just one last question, just because we're getting near to 3. So let's see. How would you code for the participant that received the 3-day approval assessment at the end of September and gets admitted on October 1st?
So it sounds like, and again, this is Denise, I don't want to go out too far onto a limb here, but when it comes to the assessment days that were in September, anything that was provided prior to September, even though the actual days of CBAS service began in October, those are 10 codes. The assessments happened in September, so the assessments should be, those are TAR-free services, so you're not submitting authorization requests for those, you're just submitting claims. So the claims should go in for anything delivered in September was as 9s and services delivered after 10-1 as 10s. But again, I'd say if you have anything that's really close to the edge there and you're possibly getting some different guidance from the plans, your plans are your payers, and I would work with your plans on how to resolve those.
Okay, and then a comment from Lydia. She's just thanking CDA and DHCS for organizing the webinar, for communicating and providing technical support. We look forward to hearing more from our plan partners on how they will be handling the transition and any instructions they have for our CBAS centers, and also the FAQ from today's call.
Yeah, great. Thank you, Lydia. And yes, to our plan participants today, there were many of you, and you got an earful. We didn't see anybody's hands go up or hear from you, so I imagine that you were listening in today to find out what the provider concerns are, definitely from the results of our SurveyMonkey survey that we went out with last month. The CBAS providers are saying they would appreciate some written guidance from all of you. There is still quite a bit of anxiety out there about being certain about what the plans are expecting from the CBAS providers, so any guidance that you can take back to your organizations and get out to the CBAS providers, they certainly would be appreciative, and it will help this go more smoothly. So thank you again to the CBAS providers for giving us all of that really good feedback. So are there any other question areas that we have not touched on today and that we need to get to?
I don't think so. I think some of them had to do with the crossover TARs, which we addressed, and then some billing questions that we addressed. So I think we got the gist of them. Great. Yep.
Okay, and we will put together some FAQs and get them posted and let everybody know who's registered today when they're posted. And just as a wrap up, we put just a checklist together here at the end of this document to address some of the things that we think providers should be doing, which should be perfectly clear after today's discussion. You should be talking to your contracting managed care plans to make sure you understand how they want you to handle current TARs that expire after 10-1 that were authorized with the 9 codes. Again, going back as far as May, because we have the 6-month time frames. What they want for submission of claims, 10-1 for services provided on those TARs in system with 9s. So when will they no longer accept those claims? Will they want single or split billing for services prior to and after 10-1? So those are going to be policies that come out of your contracting plans, and you need to know what they want from you, and that will help reduce the number of errors. You need to work with your software vendors to make sure that you understand what functionalities in the software. So we got a good look at that today. I really, really appreciate Steve, Laura, and Renee for giving us an idea where you guys are. Map the 9 to 10 code changes if you don't work with the software vendor, and/or your software vendor doesn't provide the automatic mapping, identify which participants have diagnoses that don't have the one-to-one correspondence, and for those participants that don't have the matching 10, contact the participants' personal care physicians as necessary to obtain the correct codes, work with your clinical staff, your staff physician to work with clarifying things when you can't get timely responses from your PHCPs, and then change the codes in your health records. Those are just few things. That's not the comprehensive list, but that's a good start for you. And a good start was attending this webinar today. So we thank you. And again, if you have further questions, you know where to find everybody, but we'll remind you again. Let's see. Okay, we have some upcoming training opportunities. Sorry. Here's some information about that. The ICD-10 Road to 10 training and webinar that's coming up end of September, but still just to make sure that you've got everything in place. There's an opportunity there. We'll get a registration link to you later on, and we'll let everybody know when that comes out. We will blast an email to all of our CBAS providers. So that's coming up Thursday the 24th of September and Friday the 25th. And then next slide, some more information, some resources on our CDA website, on the CMS website. I hear that I haven't seen it yet, but the Road to 10 is absolutely the place to be if you still have a lot of questions. So check on that website. And then I think that we got the tip to go to Google the anatomy of an ICD-10 code for some more schooling via Google. And then here are all our contact phone numbers and places to go when you're having distress or before. You know where to find everybody. And as always, CDA's contact information is right there on that last slide. So I think that's it for today. We'll get you some FAQs. We thank you for participating, and especially to the presenters, Wanda, Bob, Steve, Laura, Renee. Really, really appreciate you guys participating in today's session, and all of you are in the audience. So thank you very much.
Thank you for the opportunity.
Thank you.
Thank you.